I'm ready to go live.
Ready?
Yes.
Okay, go ahead.
Here we go, Helen.
Okay. Good morning, everyone, and Happy New Year. Happy 2021. I want to welcome everyone and thanking you for joining us today for this meeting of New York City Health and Hospital Equity, Diversity, and Inclusion Committee. Today's meeting is officially called to order. First on our agenda, I would like to propose a motion to adopt the minutes of the Equal Employment Opportunity Committee meeting held on March 12, 2020. It seems like ages ago. Can someone second?
Keniowski, second.
Thank you. Now I'm going to poll each committee member for his or her vote. Dr. Pagan?
Yes.
Penny? Peñamora?
Yes.
And Dr. Katz? No, he's still
Helen,
at the
Dr. Katz is not here. He's on a presser with the mayor, but we do have quorum.
Okay, perfect. So we'll move to the next agenda item. Today we have two reports. Martita Roman, our Chief Diversity and Inclusion Officer, will report out.
Thank you. Good morning, everyone. Happy 2021. So I wanted to express a few of our milestones for last year, just to give the council an opportunity to see some of the things that have happened. So since the Equity and Access Council's announcement in June,
I'm sorry, ma'am, would you please raise your voice? Could you speak louder for the court reporter, please? Excuse me for interrupting.
Can you hear me now?
Yes, oh, much better. Thank you. I apologize.
So I'd like to take an opportunity to highlight a few diversity and inclusion milestones for the system. Since the Equity and Access Council's announcement in June, the council has been building the groundwork for the work that has been happening. And in a short while, you'll get an opportunity to hear from the co-chairs about the progress made and the exciting next steps for the Equity and Access Council. It's also worth mentioning that the series of dialogues and listening sessions that happened over the summer were successful. We had a number of listening sessions for employees to discuss the topic of bias and racism in the aftermath of George Floyd, that again amplified the reality of systemic racial inequities in our country. The session served as opportunities for employees to share their feelings and to hear from one another in a safe space that preserved their confidentiality. Those sessions also provided us with valuable feedback that the council is currently analyzing, and Dr. Davis can speak about it a bit more in her presentation. We also integrated unconscious bias learning modules in our new employee orientation and annual in-service training. From July 2020 through the end of this year, over 25,000 trainings have been completed on different diversity and inclusion topics that include topics such as interreligious awareness, introduction to unconscious bias, LGBTQ affirming services, and health literacy. We also launched 3 new virtual workshops, having essential conversations, how to be an inclusive colleague, and how to be an upstander. The Office of Population Health and Behavioral Health have ECHO series, and of which we had 2 series on vulnerable populations aimed at improving awareness and knowledge about the impact and intersectionality of social determinants of health. And it was focused primarily on structural racism, stigma, and trauma. And then the second series was focused on LGBTQ health equity issues. And in August, the Human Rights Commission Foundation published the 2020 Healthcare Equality Index, and we're happy to report that all 23 qualifying sites received the designation leader in LGBTQ healthcare equality for the 5th consecutive year. Next slide, please. So let me walk you quickly through some of the employee data. This is for fiscal year 2020 with a total of 41,494 employees. The data was segmented to reflect direct service, job titles such as nursing, medical residents, employee physicians, social workers and clerical associates. It also included senior level executive roles, and the data at this juncture excludes affiliate staff, vendors, and temps. However, let me walk you through this data. Next slide, please. And I know that the board was very interested in getting some preliminary global affiliate data, so I'd like to give you some high-level points now, anticipating that in April we'll provide you with more granular information, such as what you'll be seeing for the employee workforce data analysis that I'm going to present. So just from the affiliate side, the global data is about 6,500 affiliate staff, of which 48% identify as minority and 55% represent as women. There are 56% of the affiliate physicians identify as either Black, African American, Asian, Hispanic, Latino, American Indian, Alaskan Native, or marked 2 or more races. So we are definitely very doing well with respect to diversity within both our affiliate and our employee representation at health and hospitals. And 43% of our affiliate physicians identify as females. So this is a global number that you see on the screen related to the global race ethnicity for employees that I mentioned previously. It excludes the affiliate staff. Next slide. And these are our nursing numbers of the 8,000, over 8,000 nursing titles that are across. So there are 12 nursing titles that were identified. You see a high representation of both female representation as well as minority representation. Next slide. And as you can see, our resident demographics are also very strong as it relates to New York City Health and Hospital residents that are currently in across the system, making that. And then employee physicians also, where we have a strong representation, over 50% of our employee physicians represent as in a minority group, or more than half of females. And lastly, we have social workers, and we have clerical associates. I'm happy to answer any questions that the committee members have for us with regard to the data or any of the initiatives that we've presented today.
Matilde Sosa-Bargan, when you look at data like this, do you compare our system to other systems? Do you compare it to the population in the city? Which population in the city? I just want to get a sense of like, how do you know that you're making progress on that?
So there's a number of efforts, and I think the Equity and Access Council is going to be critical in really doing a deeper dive and making those kinds of comparisons. But from the data that we did see, I think we are in a much stronger position than in other healthcare institutions in the city and across the country. I mean, just, and so just to share with you the leadership numbers as well, so that you have a sense of our racial and ethnic breakdown from all leadership, as well as it from the gender perspective. We are reflective of the individuals that we serve at health and hospitals, and I think the data really is demonstrative of that. There's always opportunities for us to improve, and that I think the Equity and Access Council is very much interested in ensuring that we are really looking at opportunities to improve our diverse representation at every opportunity that we can seek and find. And as far as looking at it from the availability, we actually run the data across, and supply chain and Keith's office actually helps us with the analysis to find availability, and we find no underrepresentation of our workforce based on how we analyze vendors in the same capacity. So we're actually in a pretty good position at this point.
Thank you.
This is Faniowski. I just want to again congratulate Dr. Katz and everybody involved in the system. This numbers on gender diversity at all leadership levels is really something to be very proud of. And I also would like to congratulate for all the effort. And thank you for sharing the information on the affiliate data, which also we see that seeks to represents the type of population that we serve. But I just want to, again, these demographics are something really impressive, and I just want to thank and congratulate for the great work that you have done to ensure that we our people represent the people that we serve.
Thank you.
Also echo what Fanny and Jose said, and I've been here through the beginning, so I've seen the progression, and I know how much work it took to get to these numbers. So I think you guys should be very proud. We still have more work to do, but I think this is a very good, I think the progress that we've done year by year, these numbers get better and better. And I think it's really a good sign that we not only, like wherever we are, we're representing the communities we're serving. So I think it's a very good testament to our mission and the work that you guys are doing. I agree with the rest of the board members.
Any other questions?
Matilde, Jose Bagan here. I had so I don't know if you know, like when we recruit people or when we, I wonder how this reflects on how we are able to attract other people. Going back to what Helen just said, how the numbers keep getting better and better, meaning that, like when you look at these figures of like, you know, the leadership, 63% female at the executive level. Are they, when they come to you, do they say, or to us, do they say, look, I want to work at H&H because of this? I'm trying to understand the effect that it is having on our ability to recruit and keep making progress in these areas. Are there ways of monitoring that, or do you keep track of that?
So we have been on the road of ensuring that our leadership continues to be reflective of the communities that we're serving. And so with that, our recruitment strategy has been expanded. So when we are recruiting for leaders, for example, we are touching base with organizations that we can also send our recruitment efforts to them so that they can get us candidates. For example, NACI, for example, AHI. For example, we will recruit in individual digital newspapers, whether it was for the Coney Island representative. We focus on the Russian newspapers, for example. When it came to identifying, for example, our future Elmhurst and Queens CEOs who will be in our minority selections, these are efforts that we made to reach beyond New York City, Northeast region. We use various sources. LinkedIn has been a good resource for us, but also using our internal networks, maximizing the relationships that we have in professional organizations, in putting out the word that we are looking for key leaders, diversified leaders, to help us move the mission forward. We have been successful, and we continue to be successful in that area. Secondly, we're also invested in developing our own staff, that tier that's in the level right below the executive director tier, our chief operating officers, for example, making sure that they are diversified and that they are being groomed for the next level. So that's succession planning in the works. And of course, taking it down to the next level, senior management, middle management, and upskilling those individuals so that they're ready for their next step. So we have a rich resource of individuals that are diversified, whether it's gender or whether it's ethnicity or other diversified classifications that are out there, disabled, veterans, etc. we're looking internally. That's a rich resource that we can maximize even better and use for the future.
Thank you.
Thank you for sharing that. Based on what you just mentioned, do we have any official program for leadership development? Some institutions have like fellows program that allows individual that has potential for leadership position to engage in kind of certain activities that allows them to understand the breadth of the institution and the roles that they may play, as well as give them mentorship on how to kind of shape their path towards leadership. Do we have any formal program like that?
We're developing.
Yes, so
Oh, Yvette, I just want to say this is Natalia
Yes.
Sinise, the Chief Nurse Executive. I just wanted to share that is in our plans for 2021 for nursing. And so I have 2 CNOs right now developing the program for middle management nursing.
Thank you. That's wonderful. Thank you, Natalia.
right. And we do have one that exists, for example, for the under the QA realm, for under Eric Way, who has developed a clinical leadership fellowship program. And we have been successful in identifying diversified candidates and giving them an opportunity to participate. So those are very 2 good examples. We also have a mentorship program that we are developing for finance, because we find that that is an area that can use some development internally for our individual employees. And so that mentorship program is kicking off in February. Some of our programs have been kind of hindered with the fact that, the pandemic kind of put a strain on things being live, and some things are virtual. So we had to kind of pivot things a little bit differently so that we don't kind of freeze ourselves in the middle of this. This is an opportunity and we can't pass it up. So we're just reframing how we do things, how we deliver the programs. But we are going to continue forward. It's just going to be a little bit unconventional.
Thank you. Do we have something for hospital administration or chief in the kind of the practitioners track? This type
So
of mentorship and fellowship programs?
For our senior managers, we had a program for the AEH. And so we have individuals that we sponsor so that they can go through that professional program, and then they do projects for us. That was, of course, put on hold because of the whole situation. We'd like to pick that up again for the spring and for the fall to see if we can do it a little bit differently. These programs are typically very professionally led, and our internal employees want that type of professional program, and we want to continue to support them. We're also looking for sponsoring it ourselves financially. It's about $10,000 to $18,000 per person. We think it's worth the investment for our senior and middle level managers so that we can prepare them for the next level as well.
Thank you. I don't know if, Alicia, if it will be possible, I will be very interested in learning more about these different programs at the different levels. I don't know if, if
Yes.
could do separate, like a briefing for me or however you think, but I will be very interested in learning more about it.
We can arrange that, yes.
Yep.
Thank you.
Are there any other questions from the committee members? And just because we're falling a little behind, I just want to make sure we keep moving. If there's any other questions, I think this work is super important. And I think it would be also interesting also to present to the full board on all this work that we're doing as well. Next, we're going to get a special report from, I'm super excited, on Equity Access Council. Natalia and Dr. Davis are going to be presenting, so I'm very excited to hear your presentation.
Okay. Good morning and Happy New Year. So I'm really excited to present our progress on the Equity and Access Council to date. And I'll be presenting along with Natalia, and we'll be here to field some questions. So as Mathilde said, the Equity and Access Council really kicked off in June. And since that time, we've been really focused on developing the structure of the council, as well as finding out, what the needs of our facilities are. So in terms of thinking about the structure, the goal of our council is really to provide the strategic direction for developing programs and initiatives that are aimed at eliminating barriers, institutional and structural inequities, and improving the health and well-being of our vulnerable and marginalized populations. So we have 4 work pillars that are in our charter, and that's evaluation and metrics, which is how we're going to be using data to measure the work that we do. We have workforce diversity, which we've spoken about a bit, but the initiatives that we will be doing to enhance attracting diverse talent and mentoring them. Our workforce inclusion will be strategies to promote inclusive practices, and equity of care, which are our strategies to eliminate racial and social inequities. Next slide, please. So some of the activities that we will be doing to support our charter is thinking about how do we review our new institutional policies that may have equity implications for the system. We'd also aim to create a mechanism for system-wide responses to current events or health disparities or outcomes that are related to equity. We'll also be identifying and supporting projects that are related to our priority areas that have been identified in the charter. And we'll also be serving an advisory and oversight role on the projects that the council agrees to advance. Next slide. So in terms of our framework, the way we've developed our structure is that each project will be driven by an equity work group. And the equity work groups will be comprised of 5 to 7 members from across our facilities, as well as a council member. And there will be 2 project leads that will drive the goals and the outcomes of each of the projects. So we will be identifying our interested employees, and we've already started to do the work to do that based on an equity and access survey, which I'll share the results of briefly. And then the equity work group members will be developing work plans and timelines for each of the approved projects. Next slide, please. So as we discussed, as Mathilde discussed briefly before, we conducted some employee voice sessions to really have real-time conversations and allow employees a safe space to share their feelings and thoughts on the topic of racism and bias. And this was done in an anonymous setting. And we also did an equity and access survey, which we released to learn about the types of equity work that was already ongoing at facilities, to learn about any innovative clinical programs they had or any community programs that they had, and as well as to identify the staff who are really interested in working with us to move this work forward. Next slide, please. So what we learned from the employee voice sessions, the first thing we learned was that employees really wanted more forums for this type of dialogue. They wanted to know that there were equity in their opportunities for advancement, that there would be accountability for improper actions when they occurred. They wanted more training in things like implicit bias, and they wanted continued leadership commitment on the issue. And I think they were really pleased that that leadership had moved forward these sessions and provided them these opportunities. The employees really believed that it was extremely important to address the issue of racism. They found the conversation valuable and wanted to see what would come out of these discussions. And what we also learned was that there are lots of employees that are interested in helping the council to move this work forward and in participating in our employee work groups. Next slide, please. So our next steps will be to complete the analysis, to define our projects once we've identified the employees to participate in the work groups. Once we have our work groups, we'll be hosting an orientation session for our members. Then we will be developing our work plans along with our timelines. And we'll also be releasing system-wide communications about our framework and the projects that we will be moving forward. Next slide, please. I believe that's it. Yep. So we'll just pause for questions.
Helen, I have a question.
Sure, go right ahead.
Thank you, Natalia. Again, wonderful work. And I like the idea of creating the working groups and the representation, and actually your approach to really get the voices and concerns and aspirations of our staff into consideration in the formation of this. My question is, are there any process for identifying how we are doing? There will be a lot of activities that will be started. There will be certain initiatives, perhaps, but what process do we have for evaluating how those initiatives or activities are performing and the impact that is having and the metrics that we will use to measure that impact? Do you have anything? I know that this is a work in progress, but I don't know if you have thought about that.
Absolutely. This is Natalia. So we plan on having report outs for all of the work groups. And as Dr. Davis mentioned, the first step is data, so that we will be tracking the pre and post of all projects. So as they're reporting out, we will be tracking the initiatives with the data group. So we've also pulled in Dr. Izagiri Alex, who's our Chief Data Officer, to help us in this plight to make sure that it aligns with our dashboards and all of the diversity inclusion metrics as well. But we are definitely keeping that in mind, and that is integral to beginning any process to understand where we are now and how are we improving. But that's part of our charter, and that's within the work groups as well. So not only do we have a standalone data work group, but the data work group is also aligned with every other work group to track their improvement as well.
Thank you. And when you have those type of information and the kind of the dashboard or process graphical information of how you're going to measure that, I will definitely be very interested in seeing it. Thank you.
Our pleasure. Thank you.
The goal is that the work groups would report back to the committee and with their specific dashboard on what they're working on and how they're going to measure success.
Correct.
They're going to keep us updated, especially since this is such a big new initiative. From my side, from my understanding, I think this not only makes us part of what our other fellow big health systems are doing, but I think it's really going to set the tone to increasing all of our goals and moving them forward. So I think it's going to be very good. I had a question about the data. Are we using any specific software to manage all this data, or is it just like Access or?
Well, a lot of the data that we'll be looking at, for example, clinical variables would be coming directly from Epic, and the dashboards that we use are through Tableau.
Okay.
So that's how we tend to visualize a lot of the data.
Because I think it would be very good in a lot of the surveys that you did, or the voice of the, I forgot what you guys called it, the voice of the workforce. And I don't think the software is expensive, but it is able to trend verbal data and make them into themes. So it's something they use a lot in research studies. You just literally transcribe all the comments, and automatically it starts making trends on most used words, most common themes based on comments. It kind of does a lot of the legwork. I mean, you would have all these sessions would have to be recorded. It goes into the system, the software, and it kind of generates like a word cloud. It generates themes based on most common word usage. So it would be very interesting to get all input. I don't know if these employee voice sessions, if they would feel comfortable being recorded. Kind of takes away a little bit of the feeling safe. But that's something to think about if you do focus groups, maybe.
Okay.
Right.
Thank you.
Well, the employee voice sessions does provide that data. It's actually not spoken, but it's typed in a lot of that information, and that's how it's truly anonymous. So you can't really hear what people were saying and say, this sounds like such and such. People are typing in their responses to a prompt, and someone is facilitating those discussions. And then those are all of that feedback, though, has been taken by the company and put together and summarized for us.
Oh, so that's
Right.
oh, that's even better news. So maybe getting the software is even easier, because you would just have to upload all those comments in. I don't know, something to think about.
Sure.
Helen, I just wanna commend all the work that has gone into this, because it is very thoughtful, very inclusive, and very thorough. Everything from looking at policies all the way to making sure that everybody has an opinion and is able to tell us what they think and give us ideas on how to move forward. So thank you so much for the work that has gone into it. And also highlight the comment that Penny made, that they need to think about how to evaluate and how we're making progress on it. It's an important element too. So thank you so much for all your work.
Dr. Katz, I don't know if you have any questions. So thank you again, Dr. Davis and Natalia, for that great work. So next on our agenda item will be an update on MWBE from Keith.
Okay, great. Thank you very much. Happy New Year. So I have a lot of slides to present, so I'm just gonna move pretty quickly, but I wanted to present an overview and a history of the program at Health and Hospitals for context, since it's been a while since I provided an update, and then some recent data and accomplishments, and then move on to our next big step for the program, which is to outline and implement a MWBE policy for health and hospitals, and then the next steps for the program in implementing that and moving the program forward. So by way of background, in 1988, New York State passed legislation to provide minority and women-owned businesses a fair share of the state's contracts. The fundamental tool in that law is to set goals on state contracts, and that's through subcontractor participation. So if you're contracting with a vendor that is not an MOW, a minority or women-owned business, we set goals on the contracts to allow for diversity participation. On the next slide, Health and Hospitals has had a program in place for many years. In 2017, we formalized and adopted a brand new procurement policy, which established 3 key MWBE procurement tools. We are allowed to conduct MWBE only solicitations. We are allowed to provide MWBE as a quantitative scoring factor in all of our solicitations. And we are also allowed to make discretionary purchases with MWBEs for purchases less than, or contracts less than, $1 million. As of 2017, the system had tracked all of our, has begun tracking all of our contracted and subcontracting spend with vendors certified as diverse by New York State or New York City, as well as other MWBE certifications. We historically averaged, prior to 2017, 4% utilization. With supply chain services responsible for the procurement of all the system's goods and services, we're able to place controls on the procurement process, including MWBE requirements. These controls consist of, tools consist of all procurements have MWBE goals in place, all solicitations have MWBE as a quantitative scoring factor, contracts are not approved without an MWBE utilization plan or waiver, and all service contracts greater than $1 million are also reviewed by our contract review committee. Since Supply Chain Services has assumed responsibility for the MWBE program in 2017, the program has increased our year-over-year utilization quite drastically. In 2018, we had 5% utilization. In 2019, 7%. 2020, we're now at 16%, and year-to-date at 18%. A breakdown of this past fiscal year's numbers. Our total eligible spend, so that excludes exempt spend or waived spend, of $800 million. Our total contracted spend, so that's directly with diversity vendors, is $110 million. subcontracted at approximately 19 million, and we have 154 diverse vendors that we do business with. On the next slide, you'll see a bit of a breakdown of that spend. So you'll see our certification breakdown. So our program tracks all the diversity certifications that are out there. We are primarily focused, of course, on New York State and New York City-owned certified businesses. So 32% of that spend is New York City exclusively certified vendors, 25% dual certified between the city and the state, 25% with New York State, 8% with the Women Business Enterprise National Council, 6% with the National Minority Supplier Diversity Council. These are the two main private not-for-profit certifying agencies, and 4% with other. You'll see our breakdown of percent of spend by race in the top right there. There's an overrepresentation of non-minority women. That's consistent with the rest of the city and state's practices or outcomes, and we are working to address that on a case-by-case basis on all of our procurements. It's also referred to commonly as the disparity within the disparity, and that is also reflected in the bottom breakdown of the percent of spend by gender. The next slide has our...
Helen, are you waiting until the end of the presentation for questions, or could you ask questions now?
I would say just because Keith has a lot of information,
Okay.
he might have multiple questions by the time he's done. So I would wait until the presentation.
Yeah, that's it.
Calendar year 2020 accomplishments, PPE, we have contracted with a New York City WBE for PPE purchases in response to COVID with 90 million in spend since the pandemic began. We contracted for pharmacy inventory management with a total contract value of 76 million, with 62% subcontracting goals representing an award to a WBE of 47 million. We contracted with a system-wide environmental services management company with a total contract value of 121 million, 30% goals on that contract, an award of 36 million. We contracted system-wide for our linen and laundry services with a total contract value of 50 million with 31% goals, representing an award of 16 million. And these three contracts were renewed contracts with us that previously did not have any goals on them. So significant success there. We also conducted our first large closed pool solicitation, restricting those who could respond to the solicitation to MWBEs only, resulting in a $12 million award to a vendor that's new to the system and dual certified, Hispanic and women owned. We also limited routine office furniture purchases to a pre-qualified list of MWBEs for all the system's routine office furniture purchases. We conducted another closed pool solicitation for advertising on behalf of the Test and Trace program, resulting in an $11.5 million award to 5 minority women-owned businesses. Metro Plus is also leveraging those contracts and will be looking to do significant business with them. So that's a great benefit there as well. We have also worked closely with EITS and moved from a transactional approach for all of their system Ethernet cabling to a contracted approach with one vendor that has 30% goals and 2 vendors that are MWBE. And that's routine ongoing work that will, provide lasting benefits and to our MWBEs there, and as well as increase capacity for 2 of those vendors. We have also, left out in this slide another item I wanted to add after discussion with Christine Flaherty is we contracted with construction management firms and awarded, I think, 30 different MWBEs under that RFP. The next slide shows the outline of the proposed policy. We've been working very hard over the past year with an internal council of all of our SVPs reviewing the policy. It sets a similar framework for other municipal MWBE programs with a legal basis for contract goal setting based on the New York State and New York City disparity studies. It incorporates tools from our procurement procedure with closed pool solicitations, discretionary purchases, and quantitative scoring. It allows for goal setting on all of our contracts at both the system and contract level. provides for vendor compliance to make sure those with MWBE goals are complying with those MWBE goals, allows for payment confirmation to subcontractors, which we will be instituting in the near future, allows for penalties as well, significant penalties to make sure the compliance has teeth, to either declare vendors non-responsive, to bar them for a period of years from doing business with us, terminate their agreement, or assess liquidated damages. It provides significant controls through an internal supply chain process called a contract control sheet, which accompanies every single contract before it is signed, and as well as going through the contract review committee and the board before larger contracts are approved. It provides for a waiver process if vendors are in good faith unable to meet the goals set on the contract, as well as exemptions like other governmental agencies provide for government contracts, utilities, real property, and for our affiliate agreements. It provides for the vendor diversity program to develop an education and outreach program, as well as a key component that many of our diverse vendors ask for, which is debriefing following a solicitation to make sure that they're best able to meet our needs and improve as they try to work with us. The policy provides for reporting into this committee of our key metrics, including utilization, like you saw here, awards and projections. And then new to the policy, which is different from, I think, other municipal policies and was a result of our internal council review, is to analyze the performing workforce of our vendors. And while we do that now, we only do it on a subset. This will be a larger subset, and it will also allow us to set goals for diverse hiring. So when we are contracting with a vendor that will be hiring on our behalf to perform the services under the agreement, we can set goals that workforce that they hire is representative of the diversity from where they're hiring from. So next steps for the program. In order to maximize our utilization and achieve our program goals, we will adopt and issue the vendor diversity policy. We are currently recruiting for 3 new positions. We will then draft a vendor diversity manual, which will have the day-to-day processes and forms for the supply chain group and my team to implement the program, further implement the program. We will develop processes with our supply chain partners to make sure every bit of MWBE data is captured, and then that way we can have comprehensive reports on that. We will make those data processes routine so we can have the information at our fingertips and respond to it in a proactive way. We will work with our compliance software and our new staff to implement a subcontractor payment verification. So when the prime pays a subcontractor, they will verify that they have received payment, and that way that provides a closed loop on that piece of compliance. We will insert payment controls on MWBE goals and spend reporting to make sure when our primes that are obligated to provide us with their subcontracted spend, they are in fact doing so, and unless they're in compliance with that requirement, will not be receiving payment. We will then work on dashboarding all of this data with our data and analytics team, begin forecasting our anticipated spend, develop and implement an outreach plan, and develop and implement a communication plan. So that concludes my presentation and questions. Thank you.
You want to answer questions?
I have a question. Can I go, or you want to go with Jose first?
No, you can go, Fanny.
Okay, thank you so much. Wow, this is quite impressive. Thank you for all you're doing. This is really, really impressive. If we can go back to the demographics, please, of the allocation of funds or the kind of the contract values. Here, I really like how you express what you call the disparity within the disparity. I think this is very important. And I don't know if I missed it, but I don't think I heard anything that refers on how we are going to be working to outreach to some of the subgroups that are underrepresented within the MWB contracting, mainly Black and Hispanic. Do we have any plans? Are those part of the next steps?
So Freddie, we have a process in place now. And that process consists of taking each procurement on a case-by-case basis, reviewing the utilization plans that are given to us, and suggesting alternate vendors when we think there's overrepresentation. So that's on our current process, and our future process will also have us disaggregating the goals, Fenny. So on each procurement, we will review the opportunity against the availability and set disaggregated goals for each category. And that will allow us to also have better compliance on that and a much more visible level of expectation for our prime vendors on that. Outreach, sorry, and then I'll just add to the outreach part, we are working to develop that more and have a better presence in the community so that we have that understanding and a better mutual communication with the community so that they can let us know what their skills are that we could then identify and plug into our procurements.
Thank you. I'm glad to hear that you're looking at specifying goals within the goals, sub-goals. I think that has been an approach that have been used, particularly to address this disparity for Black and Hispanic. And maybe just to make it clear, if you can put it in the next step, if you do a revision of the slide or the document, so that is something that is being explored, I think that will be quite helpful, because that way it's on the record, if that is okay with you.
Yes,
the other
absolutely.
question that I have is that if we look at the other certifications, they represent around 18% of the spend, the WBENC, no, you stay in the same demographics, please. Stay in the same demographics. And the national minority supplier and the others, that represents around 18% of the spend. Do you have anywhere a comparison on how those private certifications compare to the requirements from the New York City and New York State? I think it would be good to check, okay, those are private and we are using it, but how are they meeting the spirit of what the New York City and New York State certifications are? I'm not familiar with those two private certifications or the others, but that may be something that will be good to have, and I know that will be very interested to know.
Sure, I can send that to you, Fenny.
Okay. Now, if we can go to the, can you go down the slides? Again, I'm trying to keep all my questions. This one, no, the one for COVID 2020, there was a report that was made by the controller in the grade report that they have for all the different mayoral agency, and they made a statement that health and hospital did not spend $1 on MWBE during the COVID 2020 surge, which this document really showcased that is not accurate. Can you elaborate how we are correcting the record with the controller?
So I reached out to the controller, but haven't received a response. I think that's just, I don't think there's a record to correct, unfortunately, because of the way the controller reports their information and the way our spend moves through the controller's office. So only a portion of our spend moves through the controller's office, which are just those capitally funded purchases that are funded by the city itself. So all of our expense spend and all of our capital items that are funded by ourselves does not go through the controller's office. So if you look at the controller's report also, their snapshot was as of August, and for some reason that data only which also seemed small to me, of course, only showed $5 million of total spend by H&H up to that point in time. So, and Fanny, I'll say, we report all of our data to the city directly. We report our actual purchase order line level data as well as our summed up data that I show like here. So I think that's just the way the controller reports their numbers, unfortunately.
Yeah, but I think sometimes, ensuring that we have a good relationship with them, because they make a big splash with this, and definitely it make us not look good, even with the great work that has happening. So maybe there is no record to correct, but at least as we move, they're doing this every year. At least inform them and kind of explain them. I know that's not maybe what they want to do, but I think we make all the effort we can to ensure that they understand our process and how we do it. Just
Sure.
a suggestion.
This is Danielle. I absolutely agree with you. We're on the same page, and we will take that back and figure out a way to do this, but we are on the same page, yes.
Okay, thank you. And then the next one on the operation, on the policy, my question is with relate I think I really like all the different steps that you are doing, and it's something that, for example, the School Construction Authority, I believe, has led that effort on looking at the workforce diversity. And I don't know, are you using the similar system that they use? I know that they use one, but they moved to another system because the one that they have was not working that well. Or this is a totally separate type of system that you're using?
We use a software that, has a workbook. We send it to the vendor. They populate the workbook through their HR or legal department. We then translate that through the software against the latest census data based on zip code. And then the job groups and the breakdown of each job group is compared statistically. And then if it's 2 standard deviations off, that's considered an underrepresentation. I think that's the same way the federal government and the city does it currently. I don't know if that answers your question, though.
Okay, maybe it will be good to check with the School Construction Authority, because I know when I was at DDC and talking to the mayor's office, we all were looking at them because they have been doing it for longer than anybody else. And I think it will be good to just double check and see, because they have a lot of learning in that. And the other question that I have on this is that how are we incorporating this policy within the operating procedure 100-5? Because I think that will be one way to ensure that all this information is institutionalized.
Sure. So I'd say that 100-5 has those 3 key tools for procurement, for MWBE procurement, with goal setting, quantitative scoring factor, closed pool solicitations, as well as discretionary purchases. It doesn't specifically reference an overall policy for MWBE, and I think that's what this policy will do, Fenny. So I think the two complement each other, and if you look at 100-5, the procurement policy, that's really the tools for conducting due diligence in a solicitation and having that due diligence and those procurements be fair and competitive. Whereas this sets forth the systems policy and objective, and then sets forth the program and processes for diversity. It also, I should note, puts both of those programs within supply chain so they can live together, and those controls are then married up within supply chain.
Okay, I think, if maybe, I don't know what Kalisha feels is appropriate, but I would love to get a little bit better understanding, because I thought that the OP 100-5 did not have completely the tools that were necessary, and I think particularly in terms of the goals. And I just want to understand more about it, because I feel that we need to ensure that this is well documented and presented. So I will look for Kalisha to understand more, because I don't think I do. And Helen, I think that would be all for me. Thank you.
Dr. Pagan, do you have any questions or comments?
My only comment is that I've been at the board for the last 2 years, and I've seen a huge improvement in this area. And I want to thank Keith, Danielle, and all the work that has gone to making this happen. You know, we have changed you know, we have set expectations to vendors on this. We're meeting them, and there's still some work to do, but you know, it's pretty impressive. And also to Fenny, I want to thank Fenny for he always has a lot of good questions in this area, and I think part of the success is also you know, the fact that the board is also very interested on this topic, and thank you so much for all the work you've been doing. I know it's hard work. And on top of it, doing it in the middle of a pandemic where it's easy to say, okay, we have other things to do that should be done. The fact that you're doing it in the middle of a pandemic is pretty impressive. So thank you.
Pat, I don't know if you have any comments or questions. I can
Helen,
say,
I have I just want to follow up on Jose again. I didn't mention, but definitely it's quite impressive as you look at the statistics. We more than almost triple the percentage from like 3 or 4 years ago. So definitely kudos to the whole team. And thank you for all your work. And I just have another question is that you know, Danielle, I know you are in the call. I'm not so sure how we are going to clarify the notion because if we look at the executive order of the mayor, they talk about the chief diversity officer and the or the chief MWB officer. I don't know if that role of the chief MWB officer it is with Danielle or where it is. I think I just wanted to have some clarification on that. I don't know if there have been some discussion.
Sure, Penny. So I am taking the role and responsibility for the Chief MWBE Officer. As you know, we already have a Chief Diversity and Inclusion Officer, much like many of the big organizations out in the nation today. So they are separate in function. The MWBE Officer normally tends to live in the procurement side, so that would be me as representation. And Matilda is our Chief Diversity and Inclusion Officer, and we work in kind of lockstep together along with Yvette Villanueva to make all of this happen. So it truly is a partnership. And Dr. Katz and I also have a meeting tomorrow with Maggie Austin to discuss this as well. So everyone should be on the same page beginning tomorrow.
Oh, thank you. And I know that this is just a formality, but will your title now be added, the Chief MWBE Officer? I know that this is something that you are doing the job and you're doing a magnificent job, but sometimes having that denomination, and particularly in the website, that is somebody is can look at it. Again, I just want to put it out there because I think it does have significance and impact to have that title.
Sure. You know, I'll speak to Dr. Katz about it. It's sort of the same thing with relation to, let's say, procurement and supply chain. And it's not technically in my title, but falls underneath the SVP of Business Operations. But happy to have a detailed conversation with Dr. Katz about it and get back to you with some thoughts surrounding it. But absolutely open and willing to do that for you.
Okay, thank you. Not for me, for the community.
Understood. No problem. And again, Benny and Jose and Helen and all, thank you so much for your support here. We've all been working, you know, triple charge during this pandemic, and each one of you have been so supportive to myself, Paul, Keith, and team to get much of this work done. We're very proud to see the numbers being adjusted and moving up. And Fanny, very excited to have presented this to you today as well to show some of the successes with relation to the dollars that are being invested here, and looking also for future planning for community outreach and such. So everything you had said today, we have documented, and we'll come back with another report out. So very much appreciate everything.
Thank you. And maybe what we can do is like what you did with the last procurement, oh, that's 62%. That's actually was a major coup. So thank you. You have set the bar very high. Again, like you're saying, doing all this during the pandemic.
2021, you want it to be a whole new groundbreaking.
Thank you.
We are on our way.
So again, I just want to thank everyone for their amazing work, and I just want to be respectful of everybody's time because I know we're running a little late. But I just wanted to see, are there any other comments? Any old business? Any new business? And once again, I think this meeting, I think you guys have all given amazing presentation, amazing data. We're all very proud. And therefore, being no other further discussion, this meeting is adjourned. Thank you so much and have a
Thank
beautiful
you.
day.
See you, everyone. Bye-bye.
Bye, everybody.